Good morning and welcome everybody. I'm going to just make a start as people kind of filter in, just to welcome you all to our fourth webinar in the ARC North Thames Activating Research series. So today we're going to be talking about disseminating our research and how we can implement it into our practice. So before we make a start and I introduce our three fantastic speakers for today, I just wanted to introduce myself and also to run through some very quick housekeeping points. So I'm Kat Lawrence. I'm a physiotherapist and a NIHR Clinical Doctoral Research Fellow in the second year of my PhD. And I'm also the co-chair of the ARC Early Career Researchers Committee. And I will be chairing today's webinar. So Sylvia, if we could just move forward with the slides, we'll just go through some very quick housekeeping tips and how today's webinar will run. So as you can see, if you can just check your kind of audio and visual settings, if you've got any issues, if you post them in the chat or if you message Charles or Sylvie directly, they should be able to help troubleshoot during the session. Feel free to use the chat at any time. So we welcome you to post any questions or comments during the speakers' presentations, but all that we ask is that you keep yourself on mute during the presentations. So we'll be having presentations for around 45 minutes, and then at the end of our three speakers, we'll have a Q&A and a discussion session. And during that time, you can either post questions in the chat, or you can, if you would like to speak and ask your question, then please use the raise your hand function and we'll come to you and you can unmute and ask your question to the panel. We will be recording this session and we will also be tweeting about the event. So please do retweet and get involved in any discussions. So in order to make a start, I'd like to say a very warm welcome to our three speakers who have kindly given up their time to talk to us today. So firstly, Dr. Rogini Govender. So Rogini is an NIHR clinical lecturer, consultant speech and language therapist, and an honorary senior research associate at UCL. So welcome, Rogini. If you could give us a wave.
Hello, everyone.
And then also to welcome Jo Dawes. So Jo is an NIHR School of Public Health Research pre-doctoral research fellow at the Institute of Epidemiology and Healthcare at UCL. So welcome, Jo. Thank you. And then finally, to welcome Dr. Fiona Aspinall, who is a senior research fellow at the NIHR ARC North Thames Research Partnership team. So welcome, Fiona. Thank you. So these two speakers are going to give us their kind of perspectives and experiences of disseminating and sharing their research for different projects and across different areas. So it should provide some really interesting discussion about disseminating and help you to think about how you might be able to move forward with any dissemination plans for your research. So without further ado, I'd like to welcome Dr. Rogini Govender to start us off with presentations.
Good morning, everybody. I'm hoping that you can see my slides. Yeah. Is that all right, Kat? Are you seeing a full screen?
Yes, thanks.
Fabulous. Thank you very much. And thank you for that introduction, Kat. So a little bit of background about me. I work and have been working with people with head and neck cancer for a number of years, but more recently I've had the real privilege of being able to combine research in my job. But the projects I'm going to be talking to you about today actually starts well before my my sort of funded research time. So what I'd like to do is perhaps just talk to you about a couple of projects that I've been involved in and share my experience of disseminating research and some top tips for embedding research in practice and really for finding out how you know how your research is being used. So I'd like to to talk about two projects, and I've called it a tale of two projects because the first one is one that I did when I was working full-time as a clinician with no funding. And I've put this in because I think it illustrates how much can be disseminated and used even when one doesn't have a lot of money to do so. And the second one is really my NIHR PhD project. So hoping that slide has moved ahead. So a little bit about a background about these two projects. In the first project, which was an unfunded project, we purely just wanted to develop some kind of checklist and questionnaire to help our patients who'd had a total laryngectomy. Now, for those who are not familiar, speech and language therapists, usually we work with this group of patients predominantly with regard to their voice restoration. But I and a couple of my colleagues realized that swallowing is also a big problem for this particular population group, but we weren't doing very much. So we set about wanting to develop a simple checklist or a questionnaire that we could use to screen our patients in our everyday clinics. But it turned out to be a full-scale research project, as you will hear. But when we started off, the things that I think were important to actually promote the use of the findings in clinical practice was the fact that this project was something we identified as clinicians. So it was very much ground up engagement. And a group of us approached our clinical excellence network, and we wondered whether we could do this together as a multi-center project. And it turns out that the group was really quite interested in doing this. So right from the start, we had ownership of a group project. And we also brought in the patient group via the National Association of Laryngectomy Clubs, who is a charity for people with this particular condition. So right from the start, we had some good systems in place which would promote dissemination in practice. But one of the things about unfunded research is that it can drag on for many, many years. And this project started long before we had access to NIHR funding. So it started around 2006. And as you will see soon, our first sort of published paper was in 2012. So we had to find some way of maintaining engagement from our group. And how did we do this? Well, we did three key things. The one was that we had regular updates at our clinical excellence networks. And this provided an opportunity for our entire group, not just the small group working on the project, but the whole group of head and neck speech and language therapists who attended our network meetings to kind of gain skills in research. So the skills around how to apply for ethics, research governance was something we shared all along the way with the entire group. And I think that this was one of the ways in which we maintained engagement. Equally, we invited people who were collecting data to become involved in helping us with inputting the data into our spreadsheets, with checking, accuracy checking and preparing manuscripts. So there was a real camaraderie and a real spirit of togetherness in getting this project off the ground. And equally, we engaged our patients because they were involved not just in the project and in helping us develop the items for our checklist, but they were also keen to write about their experiences. And so they got involved in the progress reports that came out in the NELC patient newsletters. So this was a fantastic way of maintaining engagement over what was a 6-year time period. So what kind of actual dissemination outputs did we have? Well, the usual that you would expect. We had 2 publications. As I said, it turned out to be a project that we went down the route of scientific and very rigorous validation for this questionnaire. So we got 2 publications out of it. We presented at conferences. The work actually attracted a lot of national and international interest because This was actually the first questionnaire for people with swallowing problems who had a laryngectomy. There wasn't one already in existence. So people were naturally interested, and I had the great privilege of being invited as a keynote speaker to Australia, because they were interested not just in the outcomes of the project, but also in the process by which we did this, using our sort of clinical excellence networks. So there was quite a lot of work that's spiraled out of this project in terms of interest. We also, of course, disseminated via patient forums and spoke at patient groups, patient newsletters. And then more recently, in the last couple of years, I used a blog when we had a newer publication out. I used a blog to actually link that publication to our 2 previous validation papers. And that was a good way of sort of reigniting interest in some of this early work. So how do I know that this work actually reached clinical practice? Well, there were a few ways. Firstly, our members of our clinical excellence network gave us feedback that they were using it in practice. We are certainly using it within my own setting at University College London Hospital. It's also been used in clinical research studies as an outcome measure. So it's always great joy and quite heartwarming when you listen to a presentation and somebody says they've used the SOUL questionnaire as an outcome measure. And also, it's appeared on a national database, which is called Handle on Quality of Life, which is really about a list of quality of life questionnaires for people with head and neck cancer. So if you wanted to look for a particular questionnaire, you would search on that database. If you put in the keywords of laryngectomy and swallowing, then as you will see, the SOUL questionnaires appear. So that's a great way of knowing that these papers are sort of being widely disseminated, but also that it's being used in clinical practice. And then further to this, it's also being used in a white paper, as you will see. There's an example of that, and it's been endorsed by the European White Paper for Oropharyngeal Dysphagia. In addition, the questionnaire is now being translated into various other languages, which is fantastic. Sometimes I know about this, sometimes I don't. Occasionally, people will email and ask for permission to use the questionnaire as part of their translation or cross-validation work. Other times I find out through a citation, as you will see in this example on the slide. It's been translated into Brazilian Portuguese. So how else can I know that this is being disseminated? Well, I put up this slide mainly because I wanted to share with you how I sometimes keep track. Now, it feels a bit like research voyeurism, and I don't expect that you'd be doing this all the time. But occasionally, if you want to know what impact your research is having and what reach and significance your papers may have, then it's worth looking at the altmetrics or the dimension score, as you'll see on this slide. And these are online tools which allow you to ascertain, where your research might be used, because it gives you the geography. It tells you a bit about the citations and who's citing it and how they're using it. So, for example, this one tells me that this particular paper, which was published in 2012, and which I might add, we did very little to actually promote at that particular time 10 years ago. But we now find that it's extremely highly cited according to dimensions, and possibly 6.36 times more often than the average. And so this kind of information can be quite useful if you're trying to gather intelligence about how to disseminate your work. So moving on now to the second project, which was really my funded PhD. And this was work where I was developing a new intervention for a dysphagia prehabilitation intervention for people with head and neck cancer. And in this particular project, for those of you who are familiar with the Medical Research Council guidelines for the development of new interventions and leading up to implementation, what you will know is that this is quite a lengthy process from start to finish. And so it becomes quite important in terms of what your dissemination plan is, because clearly you don't want too much of the intervention being used prior to you actually assessing the intervention in a formal clinical trial. And in my PhD work, I had 5 linked studies. So I had quite a lot of work which was leading up to intervention development. But I also had a kind of preliminary, very early, small-scale randomized control trial, a kind of feasibility trial as part of my PhD. But what I decided for intervention was that I really wanted to focus on the aspects of development to kind of steer the conversation more towards some of the earlier studies in my PhD. And so this is exactly what I did. I actually had in my dissemination plan an idea that I was going to have 7 linked papers which were going to be sequential, but I knew that I wanted to focus on the earlier work, and so I planned my dissemination accordingly. And so I did the usual thing of conference posters, workshops. I chose journals strategically. So, for example, in one of my earlier papers, which was empirical work around how you would find out what the barriers and facilitators are, for example, to adherence to exercises in a dysphagia intervention, I chose to target the Dysphagia Journal for that. And this is a journal which is a premier journal in our field for publishing this type of work. It normally publishes more quantitative work than qualitative work. So this was a real punt at targeting this particular journal. But it was to my surprise and quite unexpected kudos, really, that this particular paper was voted as the most clinically relevant paper published in that calendar year, and in fact, it won a prize for that. And this, this was great. It was kind of unexpected, but I certainly used the opportunity to share that a little bit more on social media. And so I tweeted about it, and it gave me the opportunity to kind of steer the discussion toward behavior change and some of the theoretical work that I was doing. And interestingly, this kind of dissemination brought quite a lot of unexpected collaborations. I've had quite a lot of interest from the US about how they might be able to use dysphagia, behavior change in dysphagia interventions. And equally, I had a bit of interest from the public around this. So that was really just quite a nice spin-off and an opportunity to build on dissemination. But I was also aware that, being my PhD, I also wanted to know what kind of evidence there was that the traditional metrics were still being used for some of this work. And so again, I point you to the direction of perhaps using, the more traditional metrics that you will get on journal pages. And this one shows you, for example, I looked at how this work was cited in the literature over the last 5 years. And so I've chosen one of my papers to share with you, and you'll see that over the past 5 years since publication, it's had 46 citations. And given that this is a fairly nuanced kind of topic, I thought that was kind of a reasonable a reasonable kind of output to have. So what you will also see in the lower screenshot is that this particular article had quite a number of downloads and accesses. So it's had something like 11,000 thus far, which I feel quite chuffed about, given that it is a very, very specific area. But I think what I really wanted to share with you was how you can find out how your work is being used by using these metrics, and then perhaps thinking further about how you might want to disseminate by having the intelligence of who's using your work and how it's being used. So I do hope that that really quick whistle-stop tour of some of my experiences using two different projects, one which started off with no dissemination plan and no funding, and how that evolved, and one in which I have thought a bit more about dissemination. But these are my key learning points that I wanted to share with you. So my key thing to take away from all of this is, when you're planning dissemination, do think about timing and whether it would have an impact on further spin-off work that you're having to do. Because the last thing you want to do is to guard against elements, for example, of a new intervention creeping into standard of care, because this might really impact the trial and the effect sizes in your usual care versus your intervention. And of course, this has a knock-on effect on your ability to commission new resources and may further inflate inequities in care. So I think, as a final point, what I'd like to say to everyone, as I'm aware that time is slipping by, is that think about dissemination as the thing that links your research work to the rest of the world, and to how your research is able to impact and change society. And that would be my takeaway, for you to think carefully about that and plan accordingly. So thank you very much, and I really hope I haven't gone too much over time. Thank you.
Thank you so much, Rogini. And no, not at all. I was just jumping in to give you the last minute there.
Okay, brilliant.
Thank you so much for a really interesting presentation, and lots to think about how we can really embed research into our practice and the findings from our projects into our clinical practice, and some really useful tips about how we can think about how our research is reaching not only clinical practice, but also kind of broader audiences. So thank you, and lots to discuss later, I'm sure. So now I would like to welcome Jo Dawes. So Jo, if you'd be happy to share your screen. Brilliant, thanks, Jo.
There we go. Right, I'll pop that onto slideshow. So there we go. Okay, so thanks for having me. My name's Jo Dawes. I'm an NIHR School of Public Health Research pre-doc fellow. So I'm currently with the Collaborative Centre for Inclusion Health at UCL, which is in the Institute of Epidemiology and Healthcare. So just to give you some background, where did I come from? I originally am a physiotherapist by background. I worked clinically in Glasgow for 10 years, mainly in primary care, working in a homeless health service, which was an NHS organisation. So I provided physiotherapy care for people who had experience of homelessness. In 2008, I moved down to London, and I've worked in two different universities teaching physiotherapy to undergraduates and postgraduate students, both at University of East London and then latterly at St George's. Now, I'm also the parent of two young children, which is relevant, and I'll explain why in a moment. So I started my pre-doc fellowship in March 2020, and I'm sure that's a date that is etched on many people's brains because our world changed. So just as I left my comfortable teaching job that I knew how to do, I left that and joined UCL to take up my entirely research job. and then basically got keys to my office and then started working from home alongside my 2 young children who were also at home requiring some form of schooling. So it was a slightly weird start to my fellowship. Now, this is relevant because I joined the Collaborative Centre for Inclusion Health intending to do lots of work with people experiencing homelessness and generate lots of kind of evidence to show why I should get a doctoral research fellowship in my next plan. However, I was suddenly stuck at home in a bedroom, 2 kids jumping around, and a laptop to keep me going. So, you know, field work in homeless hostels was probably not going to happen. And so I needed to get embedded in projects that could happen. So this brings me on to the study that I did get involved in with UCL. So this is the COVID-19 social study. So I don't know if some of you may have been participants in this large national scale survey. So it was a survey finding out about the impact of social isolation, social distancing on the population's mental health. So they had a weekly survey happening, which then moved to monthly in about September, I think, of last year. So alongside the quantitative survey that was going on, they were running some qualitative work, and I got asked to lead one of the themes, and the theme that seemed to fit mostly with my lived experience was interviewing parents of young children and the impact of the pandemic on their mental health. So everything was working remotely. We interviewed, or I interviewed 29 parents of young kids and carried out thematic analysis of our findings. So just to give you a quick overview of what we found, because I think this helps, what we found tells us about what messages we needed to try to extend when we were disseminating. So if you think about the topic of mental health, there are 5 key themes that we identified from the people we spoke to. First of all, the disruption to home life. I mean, whether you're a parent or not, I think lots of people identified that the home life had changed. So there was this one mum, she had 4 kids at home, she was on her own, and she described how she had been planning on taking up work shifts, but because lockdown had happened, her kids were at home and she couldn't work anymore. So you can imagine financially this woman was challenged, and she also had to mastermind the homeschooling of 4 kids whilst also not having an income anymore. Oops. Okay. So there were also changes to the usual support network. So a lot of parents described having either formal childcare arrangements or informal with either grandparents or relatives or neighbours, local childminders, that kind of thing. So this dad described how that he and his wife had relied on grandparents for childcare, and then suddenly he noticed that, you know, they couldn't help, so a lot of that care came down to his wife. He felt that he had the easy gig being able to go to work as a carer, and that mum was at home homeschooling the 2 kids, and he recognised that that was hard. Okay, so navigating multiple responsibilities and the changes within inside the home. So we recognised that suddenly so many things were happening under one roof, and parents had to kind of navigate work, schooling, still doing all the kind of household care, the buying of the food, the organising of the entertainment, alongside a house that perhaps was more filled than usual. So, you know, normally when kids are at school, parents can get the shopping done or whatever with headspace to do that. But when suddenly everyone's at home, it becomes very, very difficult. So this dad, who had an office job, which he was doing from home, he said it became very unsatisfactory, and from a work-life balance point of view, it was not quite 24/7 childcare, but it was definitely a lot more than he was used to, and he just felt that he wasn't getting his work done. And certainly in the early stages he identified that he felt vulnerable, that he may lose his employment as a result of that. Now he didn't, so when he was talking to me, he said things were settling down. Again, this single mother who had older children, she said she felt really guilty that although she was managing to do her full-time job from home, she felt she was really neglecting her children. These were children who were self-sufficient with their homeschooling, but she felt that she basically had to ignore them from 9 to 5 while they were all under the same roof, because she had work to do and she was on work calls all the time. So there's that real sense that relationships were challenged and changed by the pandemic. And then there was this idea that lots of parents had strategies for coping. This mum here, she was married, so there was two of them looking after their kids, but they had one 10-month-old and a child who was preschool in a 1-bedroom flat. And she just said that she had to go out, she had to leave the house, whether it was to go to the shop or whether it was to talk to a friend on the phone, that just simply being in a home with only 1 bedroom and 2 very lively young kids meant that the headspace for her was really important. So these were our findings, and these were the messages that we needed to get to the relevant people. There were kind of 3 main conclusions and recommendations that I think were really important. Was first of all, employers. Obviously not all the parents that we spoke to were employees, but of those who were, we really felt that employers needed to understand quite the challenges that parents were experiencing, because not all employers had children of their own. So I think the other thing that was really remarkable about the people we spoke to was that it seemed to be the mothers and lone parents who were carrying a greater burden of the childcare and finding the juggle much more difficult, and also noting that they had less support from their employers. So dads quite often were describing how their boss was really understanding and they were doing their best, and it was what they could do. But the mums were, felt concerned that they would lose their jobs, felt under pressure to perform when they felt they actually could not do both homeschooling and work at the same time. We also recognised that there was the importance of considering flexible work arrangements, and that, done well, this could facilitate, reducing stress and increasing productivity. But there were so many parents who described, problems with access to technology, technological expectations almost that actually made stress higher. So it would be really important for employers and people, working colleagues, to actually consider what works and what doesn't. There was one mum who described a nursery activity that was on Zoom, and she said it was just ridiculous. She had a 3-year-old who was supposed to be chopping some pieces of paper up and gluing them to an art activity. The child ran off, she was holding a baby, and she was doing the cutting out on a Zoom screen with a nursery teacher and saying, this isn't helpful, this is not what I need. So opening those discussions with the right people to help understand what's going on. And then this idea about coping strategies, lots of parents stated what helped and stated also avoidant things that they were doing, so things that they had to avoid to try and prevent arguments and upset in the household. So again, I think our message needed to get out to parents really to kind of help show acknowledgement of the difficulties that they were having, and also open up discussions about how they could cope with the difficult situation they were in. So this brings me on to dissemination and impact. I certainly, as an early career researcher who's starting out in kind of moving from clinical and teaching to building my research, I've definitely been criticised for perhaps carrying out research that hasn't been published. So, my immediate drive is I need to publish academic papers. And yeah, certainly doing literature search, literature review in my current pre-doc work, I found some really interesting abstracts, but then when I've chased up the authors, they said, oh no, we didn't publish that. So I definitely think, simply pushing for that dissemination being through the traditional means of papers, you can't avoid, that is important both for you and for other people hearing, being able to cite what you've done from a scientific point of view. However, what being involved in this project has really done, has really shown me the broader picture of dissemination. So again, I'm more junior when it comes to research, but being part of a really big, established and experienced research team, I was watching the news and I was seeing the lead of our project being interviewed. I would listen to podcasts when I was out having my time away from my children, walking in the park, and I would listen to podcasts that were of researchers talking about research that was relevant to my work. So I was able to fit that into my complicated and busy life, and it wasn't a screen. I felt, by working from home in our bedroom, constantly either writing documents or analysing data or having Zoom calls on a screen, I really relished the opportunity to access information that I could listen to, and I could walk and I could be outside. So I think podcasts and radio, listen again, is really important. Who knows whether that's going to be employers listening to that, so the people that we want to reach, or parents who might consider what the research out there that's kind of reporting their experience and how important that might be for them. Also, blogs and briefings. I was kind of overwhelmed by how impressive it felt that research I had contributed to was being used in government guidance and Public Health England documents, and that felt really kind of, yeah, the stuff I was doing was perhaps improving change. So yeah, I really feel that by learning from a bigger team who are experienced, I had my eyes opened about, people being on TV, people being on the radio, podcasts that people can listen to when they're on the move, and news items. It wasn't just about the publications that I needed to get out for my own career. So what next for me, and how has my experience of working on this project informed me about dissemination and what I might, put into my grant application, that kind of thing. So I'm still chasing the funding. I've got a doctoral research grant application that goes in about 3 weeks' time. So there's a lot of work going on now. Hopefully, if I pull that off, I will spend more time sitting at a computer, possibly in my house, possibly in an office, and I will be working with the population I came to work with, which is people experiencing homelessness. Now, who knows how data collection will go in the next few years and how research will be shaped, but on the assumption I will be going out and doing some data collection in the field with people who are experiencing homelessness, I have to think about, the reach and the dissemination of the work I carry out. So I assume I'll be intending to try and reach clinicians about the aspect of healthcare that I'm trying to improve. But I'll probably also be wanting to reach people experiencing homelessness and put some of my findings out there in publications that they might read. So certainly when I carried out PPI, I've talked about dissemination with people experiencing homelessness, and they've introduced, I know about journals like The Big Issue, and I told, would publishing something in The Big Issue be useful? To which people said yes. And then they also highlighted a magazine that I'd never heard of called Pavement Magazine, and in one of the PPI sessions I did face-to-face some time ago, somebody actually gave me a copy of this magazine. And again, had I not spoken to people with lived experience of homelessness, I would never have heard of this magazine, and I certainly wouldn't have known that that was a place that I should target if I want my information to be reached by this excluded population. So that's a whistle-stop tour of my early career journey through research, planned and unplanned, but what I've learned from being involved in a project that really was not on my radar before I started my pre-doc fellowship. So just a few thanks to my colleagues in the COVID-19 social study, people who've helped collect data and certainly been absolute fountains of knowledge for all aspects of this study. You can find out more about the COVID-19 social study on their website and find us on Twitter. Thanks very much.
Thank you, Jo. Thank you so much for sharing your experiences, and in particular kind of highlighting how research in the real world needs to adapt and change, and we can't always use the kind of smooth route that we might have planned for, because I think that will be really helpful to those listening and thinking about planning their research, and also about sharing your experiences of some of the kind of engaging with some of the non-traditional routes of dissemination, and how we may think more broadly about how we can share our research with more people in more places. So thank you. And so now, in the interest of time, I'll welcome Dr. Fiona Aspinall to share her screen and start her presentation. Thank you.
Can you see my screen?
Yes, thanks.
Great, thanks. Okay, hi everybody. So I'm Fiona Aspinall. Do forgive me, I won't be looking at the camera because I've got my large screen to the side. So I apologise for not looking at you while I'm talking. So I'm a senior research fellow in the research partnership team at North Thames ARC. I do have a kind of clinical background. I was a nurse, a registered general nurse working in elderly care and in palliative care, but I'm not going to focus on the clinical side of things. I'm going to focus more on academic research that I've been involved in, and this builds on things that Rogini and Jo have already told you. So everything they've said, the things that we've done too, but this takes us a little bit in a different direction. So I'm going to talk to you about the importance of, for some kinds of dissemination, using workshops and and networks. And I can't change my screen. There we go. Okay. So as Rogani and Joe have already talked about, some of the things you need to think about are the purpose of your dissemination. So are you wanting to share your findings to influence practice policy and people's experience who are providing or using the services? Are you wanting to share methods and approaches to inform your research colleagues or to build capacity within health and social care research? Are you interested in sharing service user views and experiences? Or are you interested in sharing values that might help aid decision making or align with pressure groups, or think about a new approach to providing care? So these are some of the things we were thinking about. I'm going to talk about 2 different projects that I worked on and 2 different ways of disseminating. And these are the things that we were thinking about when we were planning our dissemination. And as Rogani and Joe have already said, we didn't always plan these things in advance. They happen serendipitously, and you'll see as I go through. So the first study I want to talk to you about was a study looking at the feasibility of assessing outcomes for specialist nurses who were supporting carers of people with dementia. And there are several different types of services that do this in the UK, but we used the Dementia UK Admiral Nursing Service as one of the as the exemplar service that we were looking at here. And so we did the study as you know, involving all the stakeholders, developing the outcome measures, testing them in practice, and then actually using them to see could they be used and what did they show. I'm not going to talk about the results of it. I'm just going to focus on our dissemination processes. If you want to read more about it, I've left the link there to the project page on the NIHR, and the relevant publications, academic publications are listed there as well that you can link onto. But obviously, as part of this study, we looked at, we were disseminating the results and the approaches to assessing and evaluating services. And we did this via the usual routes. So the things you've already heard about, academic articles, we wrote blogs, in the organisation I worked in when I did this study, we always wrote a policy summary for specialist government committees, just a 4-page briefing. But what I really want to focus on are the workshops that we ran at the end of this project, or towards the end of this project. And this had, we thought we might do this at the beginning, but following PPI involvement and specialist nurses involvement, this became more and more important as we progressed through the research, and we realised that this was actually something it was absolutely essential that we did. So we got, what we did was we got together a whole range of stakeholders. So that included Admiral nurses, people who were carers, people with dementia, other voluntary sector organisation representatives, local authority representatives, and so on, health authority representatives and so on. And we used them for 3 different things. So one of them was to share our results, so a form of dissemination. So we presented our results to people, but we also then got them within their tables. So we set people in tables and we mixed people. So there was carers, people with dementia, and support and commissioning and provider organisations on the one table. And we also had a research facilitator on each table. And then we asked them to think about the results that we'd given them and what it meant to them in their practice. And they discussed that. And that gave the delegates who attended a deeper understanding of the results and conclusions and what recommendations we were suggesting. It also gave them an opportunity to feed into our results and how we were then going to write it up and present it to the wider world. So having that involvement enabled us to focus on things that that people who were going to be reading our findings told us were important. But because they were also influencing that and how we were going to be reporting it, it gave them a sense of own. They said at the end of the session that it gave them a sense of ownership of the findings, which meant that they were going to be more willing to disseminate and use the findings. We also asked them to think about what might stop them disseminating or implementing our findings more widely. And because we had mixed groups, they were able to share different kinds of challenges, but also different opportunities for how we might be able to implement how things might be implemented. This also taught us, because then when we wrote up our papers and our final report, we could talk about these kinds of challenges and already had some stakeholder generated ideas of how we might be able to overcome them. So it was really helpful for us, but it was helpful for them as well. And then we also asked the delegates to agree one task to take away from them from the meeting. And in some cases, this was about disseminating our research more widely. So some of the voluntary sector organisations agreed that if we wrote a short summary for them, they would then be able to spread that more widely around their membership, but also other voluntary sector organisations that we didn't have clear links with, but they did. And particularly local organisations that we might not know about in particular areas of the country. And also for those who are working in practice, to take away one action for implementing the findings if they felt that, I mean, by this point we'd already established that our findings were quite robust, so it was about taking those forward. And we actually managed to get 2 dementia commissioners and their teams to take our tools forward to assess their practice, and they have gone on to do that. But the thing that's also important, as both Rogani and Joe have said, is also following up and seeing whether your research has had an impact. And in this case, obviously looking at metrics and things didn't really help us. So it was just maintaining contact with people, and we weren't necessarily funded to do that. But one of the members of our team carried on in a similar kind of project after this project ended, and was able to stay in contact with the people who'd attended and find out what had changed, what hadn't changed as a result of the project. So that's one way that you can disseminate findings. I'm happy to take questions about this at the end if anybody has any. And then another project I want to focus on is one that was based in social care in the UK. So it has a slightly different focus. And it's about a service called Reablement, which is a short-term service that aims to support people to maximise their independence and to do things with people and show them how to do it rather than to do things for people. And that's a very brief summary of it. But so we already knew that there was evidence already existed about this. There was an NIHR call to look at different ways that reablement's provided across England and which was the most effective for which people. So that's what this study was about. And one of the things I just want to say is we wrote a protocol paper at the beginning. So we translated our research proposal into a protocol paper, and then we got it published. There are some journals that'll publish, this is what we're planning to do. And that was really helpful. It's not something I'd done before this project. I knew that they did them, but I always thought, well, what's the point? But actually, it was really useful. So what it did was make people aware of our research right from the beginning. And then what happened was somebody internationally had seen this protocol paper, somebody in Denmark, and they contacted me and asked me, would I come and sit on a panel looking at reablement to inform the World Health Organization's work around reablement. And they wouldn't have known about this research had this protocol paper not been published. So that was really helpful. So I went to the World Health, it was a cross between a World Health Organization and international AIDS charities. So I went to this event, and we were broken into groups, and we talked about different aspects of reablement for different groups of people. And within the group I was in, there was about 6 of us, some practitioners, some researchers, and we were able to make use of, and I would advise everybody to do this if they possibly can, to make use of the networking and social aspects of meetings and conferences, because what ended up happening was we all realized we were quite interested in this topic, and then we've set up an international network around this type of approach to care called ReAble, the ReAble network. If you want to learn more about it, you can see it's hosted by the New Zealand University, the website that we have, and it just describes these different approaches in different countries, and we have an evidence repository. So whenever any of us publish anything about reablement, it goes on to this research evidence repository, and that's something that's really important. So obviously most universities have evidence repositories as well, but having something that's about a particular topic means it's easy for people to find us. So by using all these networking opportunities, that enabled us to develop this network, and through that network we've been able to disseminate not only our own work but each other's work, and we're doing that in lots of different ways. One of them is we're working on a book at the moment. But what this has done, for example, is and one of the other things to just say is that sometimes dissemination takes a lot. Not just the dissemination, but people actually hearing your messages can take a long time. So this research finished, I think, 3-4 years ago now. And only last week I got a contact from a London borough asking me, they'd been in contact with me before about something else, and then they said, are you the person who does research on reablement? And then they asked me, could I help inform the development of a new service that they're developing just in this London borough. So even 4 years on, that your dissemination strategies can have an impact.
Fiona, just that you know you've got 1 minute.
Okay. And also it's really important to stay on, while these networking opportunities are important, it's also really important to stay on friendly terms with your ex-colleagues. So for example, I worked with someone who moved to Vienna, and in Vienna, someone was trying to set up a reablement service. They said, oh, contact Fiona. So I've been able to advise them on the Viennese local authority and government there, and how to develop this, but also be able to say, well, actually, my colleague in the Netherlands can tell you more about training. My colleague in Denmark can tell you more about, or in Finland can tell you more about setting up the service initially, and I can tell you more about evaluating it. So you can see how having these networks are really important to help you disseminate work and the kinds of services that you're interested in. So in summary then, the key things to think about, I think, when you're trying to disseminate your research are building and sustaining relationships, both with ex-colleagues and new colleagues that you might meet at events. Involving and hearing your audience, that's really key to both developing your dissemination strategy and making sure it has an impact. And joining and maintaining networks and taking those opportunities wherever you can. And also, sometimes it's important to watch the policy context. So what's happening in the world, and where is the window for me to have most impact? So sometimes you can do research that by the end of the research, 3 years on, it isn't as doesn't seem as relevant in the world because lots of things have changed, and we've just seen that with COVID. So some of the research we were working on before might not be quite so relevant now. But if you keep looking out, you'll see the opportunities, and you'll be able to start re-disseminating your work so you can take advantage of those opportunities. When you see the slides that were shared with you, and when you see them, I've put some key tips on a couple of slides after this, so you'll have more things to consider and how to maximize your search engine optimization when you're writing papers. That's it.
Brilliant, thank you, Fiona. And thank you for sharing two kind of clear examples of dissemination and the process through which you kind of consulted with stakeholders and ensured that you were reaching the right people in the right way with those projects. So in the interest of time, we've got one question in the chat, which I think Sylvie is going to respond to, just around, so someone's writing a dissertation module that requires dissemination either via poster or an article, and whether there's any preference to either of these resources, particularly around time constraints for peer-reviewed articles. So maybe if the panel members could each give a very quick response as to article versus poster for a dissertation dissemination.
I say both. I say get your poster done quickly and then take it to a conference and then work on the paper and get it across the line. Just thinking about the systematic reviews I've been trying to do with really interesting posters and abstracts I've identified, and then it's never been published. And had it been published, their work could have been cited in my systematic review. But we recognise that papers take a long time, so yeah, do it over time.
Thanks, Jo.
Yeah, I hear me.
Yes, yeah.
Yeah, I agree, and I think one of the things to do with a poster is when you go to conferences with a poster, have a little printout of it as well, hanging underneath your poster so people can take it away, and maybe link to your project page if you've got one, or to an abstract if you've got one. That can be really helpful. But I think it's worth doing both, like Jo said.
Totally agree with that, Kat. I think posters are a really good way for quick dissemination immediately after a project for an upcoming conference. It gives a real buzz around enthusiasm for the work. It allows for networking, other people's interests, but then people are often looking for a reference for that. They remember they've heard something and they think, well, how can I reference this in some future work? And so a follow-up paper is always a great idea. Yes, it takes time. So I totally agree with both Jo and Fiona. Go for both.
Thank you all, and I would completely agree from my master's experience as well of, you know, starting with one thing, but doing the paper over time is a really good tip. So we've got one more question that we'll finish up on. So do you have any tips on how to find out if your work is used clinically if you're an academic? A good question.
I think from my perspective, no longer working in a clinical environment, it is a bit more tricky, but I think by setting up those networks, so for us, for example, when we set up our stakeholder work, we involved clinicians and commissioners, and we then followed up directly with them to see what was happening, but made it clear that we understood that they might not be able to implement it. So it wasn't like we were following them up in a testing to test them. It was to follow up, to be supportive and find out ways that we might be able to help, or make links and networks across between people who were doing it to some people who had been able to do it and other people who hadn't.
So I think, Kat, from my point of view, I've given this a lot of thought about when I want to influence clinicians and to think about how I can support them embedding work. I would often target clinical magazines professional magazines, things that people read a lot more as clinicians, but also clinical excellence networks are a good way to kind of perhaps even as an academic to get involved in disseminating your work via talks at these particular forums. Very, you know, of course, clinicians do read academic papers as well, but they often don't have the time for that. So I think clinical briefings are a great idea to try and promote that. But how do you get the evidence to know that it is actually being used? I think apart from running some kind of survey or getting involved in networks or having partnerships, it's perhaps not as easy. But I do find that it's interesting looking at alt metrics and the geography and who's using, you know, where are people reading your work, and you can get that online. So I don't know if that's of any help. But yeah.
I've just got one thing to add. I'm not sure what background the question came from, what clinical background, but having worked as an academic in teaching physiotherapy, a great route into clinical practices through your students. So, you know, there's great networks about organising placements. We have reached all the hospitals in London. So I would think if I had clinical questions about things I was doing, it would be through our placement providers and our students who are out in the field working in a variety of settings.
Thank you so much. And in the interest of time, because we have run over slightly, so apologies for that. But I'd just like to take this opportunity to say a huge thanks to Fiona, Joe and Rogni for giving up their time and sharing their experiences with us. We really hope that it's been helpful. Charles has posted in the chat, so if any of you have the opportunity to just give us some feedback so that we can adapt future events, that would be really helpful. And when you go away today, we just want you to think about how you might disseminate your future projects, how you might plan for dissemination when you're working on projects, and who you might need to involve in that process based on the things that we've talked about today. I will certainly hang around on the call, so if anybody has any particular questions, then please do stay on and we can try and answer them. But thank you everybody and have a great day.